We have another patient voice today. His name is Joselito Lopez, and he is a member of WashingtonCAN.
Woo!
Let's hear it for Joselito.
Yeah!
Hola, ¿cómo están?
Yeah!
Can you hear me?
Yeah!
Alrighty. Well, first thing I want to say is it's awesome to be here. It's cold, right? It's cold. But there's a lot of warmth here. That's a good thing. Alrighty. So, my name is Joselito Lopez. I'm a member of WashingtonCAN. I'm also a patient from Skagit County whose life has been profoundly impacted by our broken healthcare system. Over 15 years ago, I suffered two heart attacks. I was fairly healthy. I was on the wrestling team. I was also powerlifting, so it was a complete and total surprise to me to have that. I found out that I required a double bypass. It was an open heart surgery. It lasted 9 hours. I was on the operating table, and at the time I was working for Microsoft as a contractor. I was fired and dropped from my employer-based insurance on the same time that I was on the operating table.
Bullshit!
As a result, well, when I was on the operating table, you're not really thinking about like, how the hell am I going to pay for this,
We're thinking about how am I going to live?
It was more like, who's going to take care of my mom, And the thing that was so incredible about that moment, though, was the doctor who did the double bypass surgery, before he operated on me, he prayed with my mom. And he told my mom that, and I wish more, and there are doctors like this, but he told my mom that I am more valuable than money. And the doctor did not charge for his part of the surgery. He said that the hand of God is on me, and who is he to mess with the hand of God? But still, nonetheless, I was left with tens of thousands of dollars in medical debt, which almost gave me another heart attack. I was left in medical debt, and I was ultimately forced to file for bankruptcy. Medical bankruptcy, that is. I was forced to move back home. Can't go living on my own anymore because of my heart situation. After the surgery, and before the Affordable Care Act was implemented, I was routinely denied insurance as my heart problems were considered a pre-existing condition.
Boo. Terrible.
That kind of floored me. During that time, I was uninsured and unemployed. I mean, just think of that. Uninsured, unemployed. I have no idea how I'm going to pay for these bills. I'm bankrupt now. Have to live at home. And so, which I don't mind. I love my mom and I love the food. Woo! I don't have any options though. The only way for me to see a doctor was through charity care and visits to the emergency room. It got so bad that the nurses at the emergency room my name by first name.
Oh, damn.
Oh, Mr. Lopez, you're back again. I'm like, yeah, no. However, this is still insufficient. And I would sometimes go unchecked and without heart medication.
That ain't right.
I didn't have any options. The only way for me to see, I was thankful for the ACA because it improved access to care for thousands of people like me. But to bring about true healthcare justice, we have much work left to be done. Access to care is good. Well, one of the issues that has been happening is that we have that access, but a lot of doctors don't take it. A lot of, like, you can go to, I don't know, Skagit Regional Clinic, they'll see you, but if they have to, like, do any kind of, like, x-rays, CAT scan, they won't cover it. Despite all of our victories, climbing healthcare costs and a lack of transparency are crushing patients and their families when they are sick and most vulnerable. As a type 2 diabetic, the recent price spikes for strips, meters, and other supplies have been very difficult to handle. And it has. I mean, I'm growing white hair some more because, like, I'm in pre-authorization hell literally every month. The doctor will, like, say, hey, there's a really good sensor, a Dexcom 6 or whatever. And then he prescribes it to me. And then next thing you know, I'm on pre-authorization hell for 3 months and can't get the medication that I need. And I just like, I had to go to my doctor and go like, dude, it just won't cover me anymore here. Last year, my employer sponsored insurance through Blue Cross Blue Shield, more than double the cost of my meter and testing strips to $550 for a 90-day supply, which used to be around $50 per month. For testing needs, even with the recent progress in reducing insulin prices for patients like me, many of us still cannot afford the necessities we need to live a healthy life. This is just one example of the many problems that persist due to the influence of lobbyists representing powerful interest groups, from massive hospital systems to insurance and pharmaceutical companies. I was deeply disappointed, incredibly bummed out, to learn that the Keep Our Care Act died over the weekend, and that our state has failed to implement meaningful regulation of hospital systems. Murders that have been proven to reduce access to care and increase costs for patients like me. We can't afford this. And we will be back again and again in every legislative session to fight for justice.
Yeah.
That's right.
I'm here today because I don't want anyone else to go through what I, as a patient, have gone through. That's why we demanded universal health care for all our neighbors.
Right.
It's an honor to be here with you. It's an honor to fight with you. We must keep on fighting the good fight. When there are days when we will be weary, and it seems like it's a daunting thing, but in the end, our cause is right. It is a moral thing. We are all valuable. We have all purpose in life. None of us here is none the lesser. We are all made in the image of God.
That's right.
And because of that, we are all valuable.
Yes.
Thank you. Si se puede. Si se puede. God bless.
Let's hear it for Joselito.